42. For what purpose does the gentleman from Florida rise?
Mr. Chairman, I rise to offer an amendment to H.R. 1, amendment number 23.
The clerk will designate the amendment.
Amendment number 23, printed in the congressional record, offered by Mr. Hastings of Florida.
Pursuant to the order of the House of today, the gentleman from Florida, Mr. Hastings, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from Florida.
Mr. Speaker, this is the full-year Continuing Appropriations Act, which would help people living with HIV/AIDS who cannot afford their treatment by reallocating additional funding to our nation's AIDS drug assistance program. I'm pleased at this time to yield 1 minute and a half to my distinguished colleague and very good friend and colleague from Florida, Ms. Debbie Wasserman-Schultz.
Florida is recognized.
Thank you so much, Mr. Chairman, and thank you to the gentleman. I rise today in support of Amendment 23, offered by Mr. Hastings, my good friend from Florida, which would help people living with HIV and AIDS afford treatment through the Vital AIDS Drug Assistance Program. This program, known as ADAP, provides HIV-related prescription drugs to low-income people with HIV/AIDS who have limited or no prescription drug coverage. This essential national program is undeniably in the midst of a devastating funding crisis. The combination of an economic recession, state budget cuts, and increased testing and diagnosis of HIV have created the perfect storm against ADAP's fiscal situation. More patients are requiring ADAP treatment as the program has been emptied out. This has resulted in drastic cuts in services provided, and thousands in 10 different states have ended up on waiting lists to receive these necessary life-saving drugs. In my own state of Florida, with the largest of all such waiting lists, 3,276 individuals languish without access to affordable life-saving treatment. Our state has lowered financial eligibility down to 300% of the federal poverty level, while at the same time reducing the formulary for the patients who still qualify. This is an enormous problem for a state with the third highest HIV and AIDS population and the highest rate of new infections in the country. You may be shocked to know that the new infection rate in South Florida is higher than in Africa. We cannot let this happen in our own backyard to our neighbors and our constituents. Though our administration has demonstrated that funding ADAP is a priority, we just keep hitting the wall. Current funding levels for this program are unsustainable, and we must do more to help. This amendment would help give the ADAP program a much-needed boost and help thousands of patients access the treatment they so desperately need. In this budgetary climate, we must make smart and sensible decisions where we can afford to make an administrative haircut if the trade-off is saving lives. It is our moral imperative to do so. By reallocating these greatly needed funds to save ADAP, we ensure that people living with HIV and AIDS in our communities can access the treatment they need to stay alive while we stem the tide of new infections and save our nation money in the long term. I strongly urge you to support the efforts of this responsible and compassionate amendment. Thank you. I yield back the balance of my time.
Mr. Speaker, I reserve the balance of my time.
Gentleman from Florida reserves the balance of his time. For what purpose does the gentlewoman from Connecticut rise?
Mr. Chairman, I ask time and claim time in opposition to the gentleman's amendment.
Gentlelady from Connecticut is recognized for 5 minutes.
I understand what Mr. Hastings is doing here, and I too support the work of the AIDS Drug Assistance Program. What it does across the country, ensuring that more than 500,000 Americans who cannot otherwise afford it receive the drugs that they need for treatment for the HIV virus. This is one of the critical services that's offered to many who cannot afford it. It helps to improve their health and to maintain the public's health in general. Just last year, the Department of Health and Human Services had to reallocate $25 million to help states that had a lengthy waiting list. People hanging in limbo without access to the medication that we know will help them. And in these difficult economic times, more and more people find themselves unable to afford treatment. More than 700 Americans were put on that waiting list in 1 month in 2010. Improving access and for those of my colleagues. But this amendment is one that attempts to correct a piece of legislation that is not fixable. We simply cannot rob Peter to pay Paul. This amendment will pull important resources from 2 accounts that the Republicans have already decimated, that are critical to the public health of our country. The CDC, Center for Disease Control, and the National Institutes of Health. I therefore encourage my colleague from Florida to work with me to defeat this reckless continuing resolution rather than amend a bill that is beyond repair. I yield back the balance of my time.
Would the gentleman yield?
Yes, I will.
We have no objection to this amendment. We're prepared to accept the amendment.
I thank the gentleman. Mr. Speaker, I ask unanimous consent that my full statement be made a part of the record, and I yield back the balance of my time.
Without objection, and the gentleman yields back his time, all time having been yielded back. The question now is on the amendment offered by the gentleman from Florida. Those in favor say aye, and those opposed say no. In the opinion of the chair, the ayes have it. The amendment is agreed to.